The global sanitation crisis is a pressing issue that affects billions of people worldwide, with open defecation being a significant concern in 15 countries. This practice not only poses severe health risks, leading to the spread of diseases like cholera and diarrhea, but also hampers economic development and social progress. Addressing open defecation is crucial for improving public health, enhancing educational opportunities, and fostering gender equality. By tackling this crisis, we can create healthier communities and pave the way for sustainable development. It's essential to recognize that sanitation is not just a basic need, it's a fundamental human right that impacts every aspect of life. Open defecation refers to the practice of defecating in open spaces rather than using a toilet. This issue is prevalent in many regions, particularly in parts of South Asia and Sub-Saharan Africa, where millions lack access to proper sanitation facilities. The health risks associated with open defecation are alarming, as it contributes to the spread of infectious diseases, including diarrhea, cholera, and hepatitis. Furthermore, inadequate sanitation has profound social and economic consequences, hindering educational opportunities, especially for girls, and burdening healthcare systems. The cycle of poverty is perpetuated as communities struggle with the repercussions of poor sanitation, making it imperative to address this critical issue for a healthier future. India, a major challenge. Open defecation remains a significant challenge in India, with approximately 200 million people still practicing it, despite improvements in recent years. The Indian government has launched initiatives like the Swachh Bharat Abhiyan, aimed at eliminating open defecation by promoting toilet construction and sanitation awareness. This campaign has led to the construction of millions of toilets across the country, yet cultural challenges persist. Many communities still hold traditional beliefs about sanitation, making it difficult to change behaviors. Community involvement is crucial, as local leaders and organizations work to educate and encourage proper sanitation practices. Addressing these cultural barriers is essential for achieving lasting change and improving public health in India. Nigeria, a growing concern. Nigeria faces a critical sanitation crisis, with an estimated 47 million people practicing open defecation, making it one of the highest rates globally. This alarming situation has dire consequences for communities, as inadequate sanitation contributes to frequent disease outbreaks, including cholera and typhoid fever. Non-governmental organizations, NGOs, play a vital role in promoting sanitation by implementing educational programs and providing resources for toilet construction. These efforts aim to raise awareness about the importance of hygiene and proper sanitation practices. The link between sanitation and health is undeniable. Improving sanitation can significantly reduce disease transmission, enhance community well-being, and foster economic development in Nigeria. Ethiopia, progress and challenges. Ethiopia has made significant strides in reducing open defecation, with government policies focused on improving sanitation and hygiene across the nation. Initiatives like the National Sanitation and Hygiene Strategy aim to provide access to clean toilets and promote safe sanitation practices. Success stories, such as communities achieving open defecation-free status, showcase the positive impact of these efforts. However, ongoing challenges remain, including cultural beliefs and limited resources in rural areas. Education plays a crucial role in changing behaviors, as raising awareness about the health benefits of proper sanitation can empower communities to adopt better practices. Continued commitment to education and infrastructure is essential for sustaining progress in Ethiopia. Pakistan, addressing the crisis. Pakistan faces a significant sanitation crisis, with approximately 40 million people practicing open defecation, primarily in rural areas. This situation poses serious health risks, contributing to the spread of waterborne diseases. In response, community-led sanitation programs have emerged, empowering local populations to take charge of their hygiene practices. Initiatives like the Community-Led Total Sanitation (CLTS) approach encourage communities to identify their sanitation challenges and develop sustainable solutions. Education plays a vital role in promoting hygiene, as awareness campaigns teach the importance of proper sanitation and its impact on health. By fostering a culture of hygiene and sanitation, Pakistan can work towards reducing open defecation and improving public health outcomes. Indonesia, cultural barriers. Open defecation remains a challenge in Indonesia, particularly in rural areas where approximately 10 million people still practice it. Cultural beliefs significantly influence sanitation practices, with some communities viewing open defecation as a traditional norm. These perceptions can hinder the adoption of proper sanitation facilities, as many individuals may not see the need for toilets. To address these cultural barriers, various initiatives have been launched, focusing on community engagement and education. Programs that involve local leaders and utilize culturally relevant messaging aim to shift perceptions about sanitation. By fostering dialogue and understanding, these initiatives strive to promote healthier practices and ultimately reduce open defecation in Indonesia. Sudan, conflict and sanitation. In Sudan, ongoing conflict has severely impacted sanitation infrastructure, leaving millions without access to basic hygiene facilities. The destruction of water and sanitation systems exacerbates public health crises, leading to outbreaks of diseases such as cholera and dysentery. Humanitarian organizations play a crucial role in addressing these challenges by providing emergency sanitation services and promoting hygiene education in affected communities. However, these efforts are often temporary and insufficient to meet long-term needs. There is an urgent need for sustainable solutions that not only rebuild infrastructure but also foster community resilience. By investing in durable sanitation systems and promoting peace, Sudan can work towards a healthier future for its citizens. Niger, a public health crisis. In Niger, approximately 40% of the population lacks access to adequate sanitation facilities, leading to widespread open defecation practices. This public health crisis has dire implications, as poor sanitation is directly linked to increased rates of waterborne diseases, including cholera and diarrhoea, which disproportionately affect children. The lack of proper sanitation contributes to high mortality rates and stunted growth in young populations. In response, community-led initiatives have emerged, focusing on raising awareness and promoting hygiene practices. Programs that engage local leaders and empower communities to take ownership of sanitation improvements are crucial for fostering sustainable change. By prioritizing sanitation, Niger can significantly enhance health outcomes and overall well-being. Chad, overcoming challenges. Chad faces significant challenges in improving sanitation, with an estimated 60% of the population practicing open defecation. This alarming prevalence poses serious health risks, contributing to the spread of diseases such as cholera and malaria. Both the government and non-governmental organizations, NGOs, are working to improve access to sanitation facilities through various initiatives, including the construction of latrines and hygiene education programs. However, these efforts often encounter obstacles such as limited resources and infrastructure. Community engagement is crucial for success. Involving local populations in decision-making and implementation fosters ownership and sustainability. By prioritizing community-driven solutions, Chad can make meaningful progress in overcoming its sanitation challenges. South Sudan, a dire situation. The sanitation crisis in South Sudan is exacerbated by ongoing conflict, which has severely damaged sanitation infrastructure and left millions without access to basic hygiene facilities. As a result, open defecation is widespread, leading to increased health risks, including outbreaks of cholera and other waterborne diseases. International aid plays a critical role in addressing these urgent needs, providing emergency sanitation services and promoting hygiene education in displaced communities. However, while immediate assistance is vital, there is an urgent need for long-term solutions that rebuild and strengthen sanitation systems. Investing in sustainable infrastructure and community resilience is essential for improving public health and ensuring a better future for South Sudan. Mozambique, progress amidst challenges. Mozambique has made notable progress in combating open defecation, with approximately 30% of the population still lacking access to adequate sanitation facilities. Community-led initiatives have been instrumental in this effort, with programs like Community-Led Total Sanitation, CLTS, empowering local populations to take charge of their hygiene practices. Success stories include several communities achieving open defecation-free status, showcasing the positive impact of these initiatives. However, ongoing challenges remain, such as limited resources, inadequate infrastructure, and cultural beliefs that hinder the adoption of proper sanitation practices. Addressing these areas for improvement is crucial for sustaining progress and ensuring that all Mozambicans have access to safe and hygienic sanitation facilities. Madagascar, environmental impact. Open defecation in Madagascar has significant environmental implications, particularly concerning the contamination of water sources. When waste is disposed of in open areas, it can easily wash into rivers and lakes, compromising the quality of drinking water and harming aquatic ecosystems. This situation poses serious health risks for communities reliant on these water sources. In response, local communities are actively promoting hygiene and sanitation practices through awareness campaigns and education programs. These efforts aim to change behaviors and encourage the use of proper sanitation facilities. However, there is an urgent need for sustainable practices that not only address immediate sanitation issues but also protect the environment for future generations. Afghanistan. Sanitation in crisis. Afghanistan faces severe sanitation challenges, largely due to decades of ongoing conflict that have devastated infrastructure and limited access to basic hygiene facilities. Approximately 30% of the population practices open defecation, leading to significant public health risks, including the spread of waterborne diseases. Various initiatives have emerged to improve hygiene, such as community-based programs that focus on building latrines and promoting safe sanitation practices. However, these efforts often struggle against ongoing instability and resource constraints. Education and awareness are crucial in this context. Empowering communities with knowledge about the importance of sanitation can drive behavioral change and foster a culture of hygiene, ultimately improving health outcomes across the nation. Burkina Faso. Community solutions. In Burkina Faso, open defecation remains a significant issue, with around 30% of the population lacking access to proper sanitation facilities. However, communities are taking proactive steps to address this challenge through various local initiatives. Successful programs, such as community-led total sanitation (CLTS), empower residents to identify their sanitation needs and develop sustainable solutions. These initiatives have led to numerous communities achieving open defecation-free status, showcasing the power of local engagement. By involving community members in the planning and implementation of sanitation projects, these efforts foster ownership and accountability. Strengthening local engagement is essential for creating lasting change and improving public health in Burkina Faso. Nepal. A path forward. Nepal has made significant strides in its journey to eliminate open defecation, with access to sanitation facilities increasing from 30% in 2000 to over 90% in recent years. The government has implemented initiatives like the Sanitation and Hygiene Master Plan, which focuses on building toilets and promoting hygiene practices across the country. Community involvement has been crucial, with local groups actively participating in sanitation campaigns and education programs. These efforts have fostered a sense of ownership and responsibility among residents. Education plays a vital role in promoting hygiene, as raising awareness about the health benefits of proper sanitation can lead to lasting behavioral changes and improved public health outcomes in Nepal. Benin. Challenges and opportunities. In Benin, approximately 30% of the population practices open defecation, posing significant public health risks and hindering overall development. The government, alongside various NGOs, has initiated efforts to improve sanitation through programs aimed at building latrines and promoting hygiene education. Initiatives like the National Sanitation Policy focus on increasing access to safe sanitation facilities, particularly in rural areas. However, the success of these efforts heavily relies on community engagement. Involving local populations in decision-making and implementation fosters a sense of ownership and accountability. By prioritizing community involvement and sustainable practices, Benin can turn its sanitation challenges into opportunities for improved health and well-being for all citizens. In this video, we explored the pressing sanitation challenges faced by countries like India, Nigeria, Ethiopia, and many others, highlighting the prevalence of open defecation and its dire health implications. We discussed various solutions, including government initiatives, community-led programs, and the critical role of education in promoting hygiene. Addressing the global sanitation crisis is essential for improving public health and fostering sustainable development. We encourage you to engage with this important topic by subscribing to our channel, liking this video, and sharing it with others. Together, we can raise awareness and contribute to meaningful change in sanitation practices worldwide. Thank you for watching.